Nothing on the Bonnell Foundation's Living with Cystic Fibrosis podcast should be considered medical advice. Medical advice can only come from your CF physician. Cystic fibrosis can be a devastating diagnosis, but living with the disease can bring positivity and a new appreciation for each day. From the Bonnell Foundation in Detroit, Michigan, it's the Living with Cystic Fibrosis podcast, sponsored by Viatris, Genentech, and Vertex. Here's your host, Laura Bonnell.
Dr. Grace Paul is an associate professor of pediatrics and a faculty member in the Division of Pulmonary and Sleep Medicine at Nationwide Children's Hospital for the past 10 years. Dr. Paul completed her medical education at Christian Medical College in Vellore, India, followed by pediatric residency at Case Western Metro Health Medical Center in Cleveland. Dr. Paul is passionate about global CF with special focus on the diagnosis and management of CF in low and middle income countries. She is a member of the CF Foundation's Global Advisory Committee and was a member of the International Health Committee of the American Thoracic Society. She has been published and is actively publishing on CF care in developing nations and is advocating for more cost-effective access to CF medications. She and her collaborator, Dr. Sneha Varkki, received funding from the Cystic Fibrosis Foundation to establish a CF center in South India and have been working hard to improve CF diagnosis and care among parents and patients with CF in South and Northeast India and Bangladesh. Dr. Varkki is a professor in the Department of Pediatrics at Christian Medical College, Vellore, and it is a teaching hospital in southern India. She completed her undergraduate and postgraduate training in pediatrics from the same institution and has been a faculty in the department for the last 22 years. Her special interest is, of course, cystic fibrosis. From 2010, the team at CMC Vellore has cared for around 200 patients with CF. With the help of a grant from CFF and in collaboration with Dr. Grace Paul, the last 5 years were devoted to spreading awareness about CF among medical professionals, training multiple allied health teams across India, and educating parents of children with CF. We're going to talk about so many important topics in the podcast, including how many people with cystic fibrosis die before they're even diagnosed. They die as infants of malnutrition. We're also going to talk about public and private hospitals, zero coverage for chronic illnesses, family and friends who don't understand the disease, and so many different topics that we should all be aware of so that we can educate and be part of the solution. The median age of survival is between 5 to 7 years. Living to your 20s in India is considered old. And you're also going to hear from a mom in India whose son died from the disease at the age of 10. So welcome, Dr. Grace Paul and Dr. Sneha Varkki. It's wonderful to have you both. I appreciate you both agreeing to do this because I think it's really important to raise awareness. First of all, please tell us about the current situation in India as it pertains to cystic fibrosis. In 1966, you shared with me that there were only 3 cases of CF because there was a misconception that CF was just a Caucasian disease. So, Dr. Varkki, do parents know about cystic fibrosis today?
Yes, so when we give the diagnosis of cystic fibrosis to a family, it's the first time they are hearing about that disease because there is very little awareness about the condition in the community. So we need to educate them about the disease, and so that's the situation as far as even the medical professionals also go. They also believe it's a Caucasian disease, and they don't consider they will ever come across a case of cystic fibrosis in their career. So among parents, in the community, as well as among the medical professionals, the awareness was poor. But in the last maybe couple of decades, it's definitely improving, and there has been a lot of progress in the last few years.
And we are talking about it here in the United States about trying to get the word out as much as possible that cystic fibrosis is not a Caucasian disease. Obviously, it's still taking a while to get that message to everyone, including, pediatricians here and et cetera. You are talking to us from India and you work there full time. And Dr. Paul, you're, in the United States, native to India. And, I guess kind of, what is your feeling as you help and see what Dr. Varkki is, doing in India?
So the work that Dr. Varkki is doing is amazing, and I'm privileged to have the opportunity to collaborate with her. When I look at the situation on CF in India, it's actually very upsetting to me because now that I'm here, I know what can be done, what are the resources, how much our patients are benefiting from all the multidisciplinary care that we can offer, the access to medications, treatments, airway clearance, and the fact that it's not there, and like the treatment, but you cannot give it. That's the part I'm trying to help bridge the gap. And I think that is going to be my unique role in working with her. And my goal is to provide her with all the resources that I can to help with this.
And I think, Dr. Varkki, as other low-income countries face kind of the same thing, does the government there in India, do they recognize cystic fibrosis?
So as I said, the awareness is just improving. It is in the recent past, in the last couple of years, there has been, CF among a few other diseases has been included in the rare diseases policy of the government. So we are expecting there may be some changes in the policies as far as the patients getting, care from the government, some funding from the government. But as of now, it's not realized, but there may be some, in the future, there may be some improvement.
And hearing what Dr. Paul says, obviously, there's a difference in what you're able to do. How hard is that for you? Because, you're seeing these patients and, you're living in India and what your patients are missing. How hard is that?
Yeah, it is hard because, I've had an opportunity to visit US actually multiple times and see how care is being provided there, how parents and families and children are, how different they are in terms of their health. The diagnosis is made right at birth through newborn screening, and multidisciplinary care is provided uniformly across the country. That's not the situation here. There is a lot of variation from place to place, and mostly because the parents have to pay for it. It's that really limits the amount of care they can get. So it is hard that even the type of care they could have in India in terms of antibiotics and physiotherapy, the medications for that, etc. Even what is available here, sometimes they are not able to utilize because of the financial, aspects of that. And there are families where there are more than one child, and it becomes really very difficult for them. And many families have lost babies prior to this current child was diagnosed to have cystic fibrosis. And so these are all very, it's all very difficult situations for the families as well as for all of us doctors and other professionals who care for them. And many of our children who we diagnosed as children, they have grown up to be young adults, and they have reached about 20s or the early 20s, and they have advanced lung disease, and we have lost a few in the last few months. And that's very heartbreaking to see that when if they were born in another country, if they were living in another country, they need not have died right now. There would have been a full life ahead of them. So these are difficult for us as professionals, but it's even more difficult for the parents, the parent community. So, but we want to keep a very positive attitude of doing what we can right now. What we have in our hands to do it as best as we can do right now, so that when the medications become available, and I hope it is pretty soon, the children can benefit out of that.
And you talked a little bit on life expectancy, but what is the difference in life expectancy there? What are you seeing, Dr. Varkki, and how many patients, we talked about this before, do you So I have several questions. How many patients do you see that die each month that you were not able to help? And, what's the challenge as far as talking to patients about life expectancy?
Yeah. So the number of patients, I see there are two distinct peaks in mortality. One is we lost a lot of at a point is when they are very young infants, 2, 3, 4 months age group, when they die obviously with cystic fibrosis, but usually that diagnosis is not yet made. Sometimes it's made retrospectively when the next baby is born. So that is a peak right there in early infancy. And then the next peak is, like I said, around 20 when, they reach the stage of advanced lung disease. So if you say the average may be about 10 or 12 years, but this is the two peaks of mortality as I see. So among the patients who we have diagnosed, about 25 to 30% have already, died. So that is a difficult situation.
Dying of malnutrition, is that one of the challenges there in India? So it's hard to diagnose at birth?
Yes, so dying of malnutrition is because of the malabsorption here. So that age group, 2 to 3 months of age, it's a matter of just a few kilos, they don't gain much after their birth weight. So there are multiple reasons for this. It could be infections, or it could be many other reasons. So the doctors may get confused with that, they may diagnose another condition which causes malnutrition. It's not lack of food, but some malabsorption or some other disease interfering with nutrition. So that's why and because CF is not considered as a very common condition, and at that point it is difficult in a sick baby to make the diagnosis of CF. That is why the diagnosis is not made.
And you do not have newborn screening now because it's too expensive, correct? And they're not ready? The government's not ready to fund it yet?
At a national level, we do not have newborn screening, but the test can be done. If a parent wishes to do the newborn screening, test can be done. There are some hospitals which do that on a small scale, or on at-risk patients when there is a history of a baby dying in the family. But on a national scale, the logistics are, it's too high an expense to start newborn screening. One, because of the expenses. The second, because we do not know how many we are expecting. Unless we have those numbers, it's difficult to initiate a program and invest money in that area. So that's a problem. So our first aim is to get an idea of the numbers in India in terms of the diagnosed cases, and then go forward and maybe do newborn screening as a small program to see what numbers we are looking at.
And I have another question for you, but I wanted to ask Dr. Paul if you wanted to weigh in on anything that Dr. Varkki, just said right now.
No, so knowing what are the difference in life expectancy is just like so striking. And, it's actually like you have what the treatment. Now, how do you get it there? So that's something, we from US can help in many ways. So that's one thing. And I think when she mentioned newborn screening, I think it took many years, even in the US, to get a very good program running. So as she mentioned, we have to show them numbers, like what's our current, because we have prevalence data, incidence data from like 20 years ago, and a lot of our extrapolation is based on that. So if you show them current numbers, I'm sure the total number of patients or the incidence is much higher than what we have seen even in the US. So that's what we need to focus on.
And I think it's important, too, to point out, and the comparison isn't fair because really, I would say in comparison to India, we in America have nothing to complain about, but we are not perfect. There are still people who are not insured here because of the way our system is put together. We still lack in diagnosing people of color. It's shameful the way that is still not properly, people are not properly being diagnosed with cystic fibrosis. And we've had newborn screening since 2007. Both my daughters were not, didn't benefit from newborn screening. So yes, America is doing better, but we still aren't where we should be. Dr. Varkki, I also wanted to ask you, how do you talk to parents and patients about life expectancy? Because you've told me sometimes they die before you've even had the conversation.
Yeah. So this is a difficult part. In the beginning, when I started working with CF, the very first time we make the diagnosis, I used to discuss that point. The life expectancy may be short. These children do not live that long. So then soon I realized when I say that, because they have come with a very sick child, and when you hear that, they say, okay, if it's not going to work, let's just go home. They just go home. They don't come back. So after that, I changed my approach a little bit. So I decided to talk about it a little down the line. So I start treating. When you give the enzymes, the change is remarkable. Within a month, a child who has been losing weight steadily starts gaining 1 or 2 kilo, even an infant. And their lung improves, and the quality of life really shoots up in the next 2-3 months if they adhere to treatment. So, that gives them a hope at that point. And then, further down, we discuss there is a problem, the life expectancy may not be as good as a normal person. This was the conversation I used to have 10 years back. But now, in the last few years, my focus is on there is a treatment out there. So we just need to keep these children alive and well till we can get our hands on the medications. So I try to put it in a positive way to them, but the reality is there. Some of them, by the time they come, they have very advanced lung disease. So we have to talk about that. This lung may not last that long. So we have to talk. But sometimes the parents are very hesitant to open that topic with their children. And I am here talking about the young adults who are 20, 21. Even recently, the one child, the girl I lost, they didn't want to talk about that part to that girl at all. So sometimes we miss the opportunity to have that conversation. We've had the conversation with few children, but with some we haven't had, and the last minute was, they were unprepared. So, it happens both ways. So right now, I am really hoping, I won't lose many children, and they will, keep well till we have access to better medications.
And talking about that, and as far as drugs and what you have access to, what is your biggest challenge? Because I know, we talked about enzymes. I mean, just the basic but very important things. So what are you in need of in India, from the basic to the modulators?
So we have all the medications except modulators. We have all the antibiotics, the enzymes, the vitamins, hypertonic saline. Everything is available, but at a cost. The cost has to be borne by the family. That's the only difference. So what we need is these medications to be available at a lower cost, especially the enzymes, because the others are not that costly. And as the children grow older and the disease advances, they need multiple hospital admissions, and they need help with, antibiotics and in hospital care. So that is what what we need. The chest physiotherapy and airway clearance therapy can be given without much additional cost, because we follow hand tapping, percussion, and a cappella and aerobica, which are, it's costly, but it's not that costly. If you buy one device, you can use it for months to years. So the main challenge is spending on enzymes. That's the number one is enzymes. If that cost could be reduced, that will be a great help. Once the nutrition status goes up, a lot of things falls in place, naturally. So, yeah.
And Dr. Paul, would you agree? I think that's maybe one thing people don't realize, that you just need the basics. And I know so many, and Dr. Varkki, we also talked about this, but some families don't give it to their children every meal, or it's every other day, or they're trying to think of a way to stretch the enzymes they have because they're paying for everything out of pocket, including hospitalizations, which we'll talk about later. But, the difference between public and private, but how do you see this, Dr. Paul? I know you said you could be in India all the time, but you have a good perspective and way to help from the U.S.
Yeah. Just to go back to why I started this. So I moved here 22 years ago, but I've always had this passion on what am I doing here when there's so much need in India? And I think right now I'm in a good position to help with channel some funds and resources to India. And I feel this is more impactful for them. Regarding medications, I know we are working with some pharmaceutical companies there to help with more sustainable cost or cost-effective enzymes. There are some generic medications available, but it's just not validated as yet. So that's something some work that needs to be done. And I know there's no pulmozyme or modulators, and we are advocating for modulators. But it's going to be some time because we need to provide data to show how many patients actually benefit from it and how many what would be the market.
And that's one thing I wanted you to talk about also, Dr. Paul, that is the high infant mortality that there is in India, and how important you say it is for them to see those numbers and see the statistics so that they are invested, because you have a population of 1.4 billion, and that's billion with a B, in India. Yeah. And you could potentially have more patients than we have in the U.S. diagnosed with cystic fibrosis, and more patients that are currently diagnosed in the world, correct?
Yeah. So there was some recent calculation. So in India, we talked the population numbers are high, but the birth rate is also high. So for example, in 2021, there were 23 million live births. And with this, the estimated incidence or the new CF diagnosis around 700 to 2,700 babies per year. So that's a huge number. So, that's the thing that we need to show. And so this is the number of live births. And so we know many infants in the same family have died before or have come in very sick with severe lung disease or malnutrition. So what we are hoping to prove is that CF is a huge contributor to the pneumonia or the malnutrition or the dehydration, which were cited as reasons for death. And if we are able to show those numbers, I know the Indian government is very keen on working to reduce infant mortality rates, and this would be our contribution, saying, think about this disease also, and maybe things would change as we potentially initiate newborn screening and educate the families more, not only families, the physicians also more about this.
And Dr. Varkki, did you want to add anything to that?
No, I agree with what.
Thank you. Sorry. The lingering cold is lingering. And then if, Dr. Paul, you can talk about how the CF Foundation here in the U.S. has helped, and talk a little bit about the global network as well.
So first of all, I think the CF Foundation, we are very, very, we appreciate them very much because they have believed in our cause and have supported us not only by just encouragement, but also with finances and some resources. So we're thankful for that. With the funds, we were able to sort of create a small CF team in India with some salary support we were able to purchase some sweat equipment, and also currently we're able to genotype our patients because we have funding. This has helped us, we are going to publish this soon, but this has helped us identify some of the genetic and also genotype phenotype correlations. And we are seeing F508 delta there, but that's not our most, like, it's our most common mutation, but there we have so many other mutations that we need to highlight. So with the foundation's encouragement and funding and support, this has helped us jumpstart the process, and we are appreciative of that. The network is the CF Global Advisory team, and it involves a lot of physicians, parents, CFF leadership. We are all working together to identify the need and potentially create registries and see how the foundation can help.
And Dr. Varkki, how important is it to raise awareness about the situation in India, not just in India, but also in the U.S. and all around the world about, what CF patients are going through and challenges for, you as a physician there?
Yeah. So it's very important. It's among all groups of people. So it's important for the policymakers, the decision makers, and the government to know about the disease, so that they, when they hear about the statistics, they pay attention and they make the appropriate decisions to help these conditions, the patients with these conditions. And it's also important for the community at large to be aware of this condition, because now there is really, really very little knowledge about this cystic fibrosis. For the patient families, the support from the extended family, the friends, neighbors, their colleagues, all that is important, because if no one has heard about this disease, they will get no support. And for example, if you say cancer, everybody knows about cancer. So if a family has a member with cancer, the whole community comes together to help that family to get through the chemotherapy and all that. Whereas with cystic fibrosis, they get no support. There's a kind of disbelief among their, the people known to them about, what kind of condition is that. We've never heard of such a thing. It must be wrong. The diagnosis must be wrong. Go to another doctor. Those kind of advices coming in is not really helping. So it is important not just to the parent community and to the medical professional. The whole the whole world needs especially countries like in a non-Caucasian population, they need to know about cystic fibrosis for the parents to benefit. And I think the social media network, the social media influencers also can do a good job here. Movie makers, if you have a movie about cystic fibrosis in India, that may be a good way to reach people here. So
absolutely. And this podcast, but
Yeah.
it takes so many to get the word out. It's so important. What I want to ask both of you, but I guess I'll start with you, Dr. Varkki. What is your hope for the future? I know everyone, in the U.S. and everywhere, it's like Trikafta is the CF modulator that everyone wants to have and feels like holds the answer, but it's complicated and it's different for every low-income country. I mean, your basic needs on getting enzymes is something you're struggling with, so it isn't just a one answer fit for everything, correct?
yes. Yeah, in terms of priority, what I want first is all the babies born as of now who have CF to be diagnosed, to be recognized, and the basic treatment started with the help of a multidisciplinary care. That is what I want first. And accessibility to the medicines like enzymes and vitamins and antibiotics at a lower cost, which the families can afford. They may still have to pay for it, but at an affordable cost. That's the second thing I want. And obviously, I want modulators to come as fast as possible in some form or the other. So because at least 60-70% of our patients will be able to use that, at least as per the count now. And there will still be 30% or 25% left behind, and eventually, maybe gene therapy or curative treatment. That is the next dream. So for now, the basic treatment, recognition of all the cases, and then basic treatment to them.
And so where the United States has about 10% that doesn't have a CF modulator, you're saying it would be about 30 to 35 in India.
Yes.
Very interesting and great to know. And what, from your perspective, Dr. Paul, did you want to add anything about this, movement of raising awareness and, what you see as a complicated issue?
So I think first, Dr. Sneha and I have a lot of hope that there is, that we can do something about it. At least we are laying the seeds for this, and things will improve because we are starting at ground zero. There is this is where we are starting. So I think my goals are to help her with all the resources that I can, because I can provide some things, but it's not sustainable. So we need to build the infrastructure there where they can work independently with indigenous resources, indigenous support. So I'm hoping that my role and my goal for this would be to provide resources, support, funding if there's anything possible, to at least spread the word, provide some basic care. And then another big thing is advocating and writing. So that's something we want to do on a big scale. And that's where I'm hoping to do more in that.
Which leads me to this next question. Great segue. Thank you. What are parents going through with the diagnosis? How many CF centers do you have? And I know you touched on it a little bit, but is it officially recognized? And then maybe talk a little bit more about how coverage works between the hospitals that you have, Dr. Varkki, in regard to chronic illnesses.
Yeah. So the hospitals, I don't think we can call ourselves a CF center because we cater to different types of conditions. CF is one of the conditions we treat. So there are centers, at least 20 to 25 centers across India, which is, that's not adequate for a country like India, where doctors who are well trained in CF care, care for patients. And there may be another 15 to 20 other centers where they can liaise with the higher center and still provide most of the basic treatment. So we are really trying to make a kind of a network of doctors, even if they are in a remote area. Nowadays, it's possible to consult each other online with problems and, give the basic care, even if you're staying in a very remote area where there is no facility to actually have a CF center per se. So that's one of the things which we are trying out, and we are training not just doctors, also nutritionists and physiotherapists through online platforms to, we have uploaded a lot of videos on how to, provide these care so that maximum number of people can learn about it and can provide the care, even if they are not recognized CF centers. Because that model which works in US may not be really, a working model for us in India. So this is what we are trying to do.
And I just wanted to clarify just a little bit. You have public hospitals where the care isn't as strong. Is that correct? And then you have private hospitals where approximately middle class, as it, can pay for CF care. Is that correct?
So the public hospitals are, every district, a state will have multiple public hospitals, but where the medications are provided free of cost and the consultation and admissions are free of cost. But it is not enough for the number of people there are. The the public hospitals. So there are some centers which are extremely good, a few scattered across the country, but on an average, the public hospitals may not be able to provide for the population around which it is supposed to serve. So most people get care from the smaller private setups, smaller clinics, and little larger hospitals. So you could say the majority of care is provided through the private setup, where they have to pay for everything: medication, consultations, admissions, etc. But you can choose depending on your ability what level you want. There may be not so costly hospitals and very costly places. So depending on each person's paying capacity, they choose that.
And then, Dr. Paul, if you can clarify a little bit, we're not talking about 25 CF centers in India like we have CF centers in the U.S., correct? They're not the same.
Yeah. No, so I know Dr. Sneha's team, she's the only doctor there, and one dietitian, one respiratory therapist, one coordinator. And that team also keeps changing. She's our steady person, but they all do other work, and CF is just a part of it. So our centers, we are now a lot of focus. I think here we have really done very well from a physical health standpoint, and a lot of our focus is now on mental health. And there they cannot even afford to do that because everything is end stage or too late to change anything. And then there's a huge cultural component, societal pressures. There are many other challenges there. So the infrastructure and teams that we have here, or our clinic, is very different there. But I think what we have achieved is now it's not only physician to physician collaboration. We have our nurses can help their nurses, our RTs can help them. So things like that, we have set up something. So I think that's how, from the US or other developed nations, we can help India and other similar countries with smaller CF centers. These are not accredited centers or anything, but the principles are the same.
And that's what I wanted to get to. Yeah, they're not sanctioned by the same rules that the CF Foundation requires all the clinics here in the United States. You're just doing, obviously, the best you can with what you have there in India, which is amazing. And then you touched a little bit about there isn't extended support by family and friends because, Dr. Varkki, they just don't understand the disease.
Yes, which is true. And here, especially in the villages, it's, people live like a family. There is very little boundaries between families. So sometimes the stigma, the parent does not want the neighbors or the friends to know the child has got cystic fibrosis because of the genetic nature, the problem associated with that. Because they have to hide, then they may, forego giving the treatment in front of, others. They may not do the chest physiotherapy on a day when there are others in the house. So this kind of problems happen, because of the lack of awareness and the support from So it's very important to get that support. So we encourage families to at least let know their immediate extended family or the close friends to know about their disease. But people choose to do that in different ways. Some parents do not, some parents do. And it works differently for different families.
And we're going to talk more about families in a minute, but first, thank you, Dr. Sneha Varkki, for putting me in touch with Dr. Deepti Raidu, and her son Shreyansh died from cystic fibrosis, and we join her now and hear her story. I just want to welcome Dr. Deepti Raidu, who is very busy delivering babies there in India. So thanks for making time to talk to us about this very emotional and important discussion about cystic fibrosis in India. You had two sons, and Shreyas died from cystic fibrosis in February of this year, and your other son does not have cystic fibrosis. Kayanch does not have
Yes.
cystic fibrosis. So tell me when you learned that Shreyash had CF. How did you find
So,
out?
so it actually is like when during my antenatal checkups, I had uh, in the late trimester, there were dilated bowel loops on the scan, and which was later not at birth. It was too late to terminate. I continued the pregnancy, and at birth, I had asked to do the testing, but they haven't done. So at the age of 1 year, he had intestinal obstruction, and then we had to, admit him in the hospital. And there we have actually, when I insisted again to do the testing, then they had done the test, and it has come positive for mutation 508.
And so you were able at 1 years old, after seeing some symptoms, and you obviously work in a hospital, were you able to get the sweat test or?
No, we directly actually sent for the genetic testing directly. The blood sample has been sent instead of the sweat test.
Okay.
Because I had a suspicion at the birth, but in spite of me insisting, it was not done. So at the age of 1 year, when I had again an option when he was admitted, I requested for the test, the blood test, and they had done that test.
And how does no one listen to you? You're a doctor, and
Yes,
I mean, I know it's different in every country, but it's kind of, there are similarities.
yes,
How
I
does that
know, I know.
happen?
It does because they feel it is rare in India, which it's actually not now, and so they felt it was a volvulus, wherein there is rotation of the intestines. So they thought it could be due to that. So that's how they denied to do the test. They told it is a simple case of volvulus and he'll be absolutely fine. That test is not required because it is very rare in our country.
And as we know, it is not rare. I mean,
It's not.
the more we can diagnose people. So, how did you feel upon that diagnosis?
No words. I still can't express it. It was just heartbreaking.
And how was his life with only certain medications available? What kind of life did he have for those 9 years that he was diagnosed? What kind of meds?
So basically, initial 1 year, we were just treating him symptomatically for whatever infections he had. And once he was diagnosed, actually, life was a little easier. And we would give him regular nebulizations of levosalbutamol and Budicort, regular nebulizations and regular supplementations of, pancreatic enzymes. And so the only difficult part is, taking medications is still fine, but he coughing out that cough every day, every hour, it is just painful for us to see, but it's more painful for him. But he never used to complain and never used to express anything. We used to just tell him that it is for your betterment, and he used to say okay. And even for the chest physios also, initially, yeah, for a few days it was very difficult, but later on he got used to it, and he used to, cooperate with us for the chest physios also.
And watching him daily go through this and knowing the short life expectancy in India with somebody born with CF, how did you deal with that mentally? And also, I know your phone keeps going off. If you want to put it on mute,
Yes.
it's fine. I know it's hard and you're a busy doctor, so I totally respect that. But
I
how,
kept it on mute.
yeah, how do you get through that knowing what you know with him?
I'm still not able to accept this, and till the very last day, a mother can never be ready for a child's, short life expectancy. of a few questions, there are no answers. It's just what I go through every day. It was so difficult, even on the last day, also, it was so difficult when he was just leaving us. I don't have words to express this, Laura.
And it's only been a couple months. I don't want to imagine. I can't imagine. I know so many people who have also had to deal with this tragedy, but you're delivering babies every day, and you have
Yeah.
another son without CF. How do you keep going forward?
Now it's more of, taking care of my younger one because he's all alone. He's been playing with his brother for all these 6 years, and he's all alone now. And the moment he's just ideal without any activity or any game or anything, the only thing he does is he talks about his brother. Where is he? When will he come? What is he doing? Why did he leave us and go? Why is he with God? Why can't God come and stay with us? All these kind of questions. So I'm trying to keep him busy and keep myself busy with my work. Yeah, but still, he is still there in my heart and soul, and I
So,
can never forget.
absolutely not. And what happened toward the end? Was it pneumonia, or what, you know, complication from CF took him?
So at the end, what happened was in November, the intestinal obstruction triggered, and it was so bad to the extent that he had to get operated again. And they have cleared everything. And basically, so when he was getting operated, also he was not given general anesthesia. He was given it was done under epidural. So that itself was a very challenging situation because if we had to give him a general anesthesia, there was no chance at that point of time he would have come out. But the doctors here, the doctors team which I was associated with, were very kind enough and patient enough to listen to me and try their best, and they have given epidural and got him out of the surgery, made him recover, and he got back onto 2 liters of oxygen again from the non-invasive ventilator. He was again back to 2 liters of oxygen on nasal prongs. We took him home, but 10 to 15 days later, there was again secondary infection, chest infection. So later, again, the oxygen requirement increased. So he went on to the BiPAP, and with BiPAP, we managed him at home for 1 month. But yeah, at the end, he gave up.
So tragic. I'm so sorry. And what what do you want people to know? Do you think if he was living in the United States or somewhere else with more access to medications that he would still be alive? Or what is the message that you want everyone around the world to hear about CF in India or any
Definitely,
country?
definitely all over the world, all kids, whoever are there, first thing of my advice is see if kids need medication. Whatever medication they are on, they need it on a regular basis. So a few people, few parents, they feel that if we are giving so many medications, they'll get used to it. But the point here is CF kids need the medication. So it has to be given on a daily basis. Let it be a laxative, let it be a bronchodilator, let it be a steroid, let it be an antacid. All these drugs, let it be a pancreatic enzyme, they will need it in every meal, and whatever for the chest, for the intestines, for the gut, everything, whatever necessary is necessary for them on a regular basis. So, and for the chest part, there are much more medications which are available out of India, which are not accessible to Indians, which are not accessible to Indian parents, in spite of the toughest efforts everybody is putting in from every state. I feel we need to get access of all those drugs which are available in other countries, in India also, at a reasonable prices too, because they are way too expensive for a normal person to afford. So
And
I think,
and I was going to ask you, I mean,
yes,
even enzymes,
yes,
families have problems getting enzymes or allowing children to have enzymes every day with every meal because they just can't afford them.
yes. There are other brands of enzymes also, which I am trying to, reach out to parents, which they can afford, which are equally effective. Yes, but there are few companies, multinational companies, which the purity might be different. But there's not much difference, that they have to use that only. Always the better purity ones is best, but whatever we, at least for the survival, whatever is required, we have to start using those. So whoever is suffering with this kind of issue, they all have to put down a step and request pharma companies to let down the prices for at least these kids, maybe on the basis of providing the immunization certificate that yeah, they actually have the disease and they need the medication on a regular basis so that they can come down on the prices. So this, some way or the other, through some trust or through some foundation, it has to be done, and it has to be, easily accessible to all the parents. Not that it should not take weeks time also.
Right.
So these things I'm getting to know nowadays.
It seems like there is so much to be done. Raise awareness, educate more the governments in low income countries, Minister of Health, all sorts of drugs, not just one. It seems like there is so much work to do to get the word out. And I know I'm not the first person to say this, but where you live shouldn't matter if you live, right?
Yes,
And the rich shouldn't be the only one who can move to America for drugs or
yes.
buy drugs from neighboring countries. I mean, it really has to be for all. And something I want to back up and talk about was I know, after talking with Dr. Varkki, that if your first child has CF, some parents, if they find out that they have a second child with CF through genetic testing, they can, abort the baby. And I wondered if you're hearing a lot of that and what you think about it. I mean, I make no judgments at all. I'm just asking,
So
what.
it again depends on parent to parent. Again, the affordability issue comes. Every child is important. It's not that a CF kid has to be aborted. There is survival, yeah, but the approach of drugs is limited to us. But the thing here is, it is finally the parents' option, which they have to decide. Even I have come across patients with, you know, having first child CF baby and second child, they come in, they get tested, it's positive, and they don't want to continue. So I leave the choice to the parents because they are the ones who are supposed to take care of that baby also along with the first child. So it how challenging it is for them, how or how much of limited resources they are getting, and what is their affordability and financial commitments, all this come into place. So we have to leave the option to the parents, but it's not mandatory that a CF child has to be aborted. I i had 10 years of glorified sweet child with me. So I don't regret giving birth to him.
And tell us a little bit about him. What kind of kid was he?
He was very jovial, always smiling, no tantrums, very, too matured for his age. I think all the CF kids are mature for their age because the kind of responsibility and everyday discipline they have in their life, I think every CF kid is mature enough. And he's just a sweetheart. He's just a sweetheart. I have no too many words to explain him. Um, he used to understand everything, even the medical part. He knows how they have to put in a cannula, when they have to put the sticker, when they need the dry cotton, when they need the wet cotton, everything. He used to give instructions to sisters in the hospital. I just miss him so much today and
I
every day.
I'm sure a part of your heart is gone, and you're remembering him every day and trying to raise awareness in his honor. That is a beautiful thing.
Everybody, actually, what I feel is, we have to include cystic fibrosis in the regular screening process during the pregnancy. That is what I feel, and I'm trying to do that here in India, because there are many kids, so many kids in India also. So I think it should be included in the regular screening procedure, because at least the parents will be aware of what's going on. It should not be a surprise for them later.
Right. And it took a while even to get on newborn screening in the United States. It was
Yes.
2007. My
So,
daughters
yes.
were not diagnosed on newborn screening. So you are 1,000,000% correct, of course.
Yes.
It
Like Down syndrome and few other syndromes which we do on a regular basis, I think this also has to be included in a regular screening process during the antenatal period of pregnancy.
How is your husband doing? How are the both of you doing? And where do you want to see the future of India go in regard to CF?
So my husband is also trying to cope from this loss of our child, and he is trying to keep himself busy and trying to be busy with the younger ones also. And yeah, the future of CF in India, either that's what, as I earlier told you, we have to put in into the regular screening basis, and whoever children are already there, all of them should get access to medications as soon as possible, because it's really very difficult to take that mucus out. It's very difficult, and it is such an agony to for the baby and for the parents to see that child suffer, so much to take out that mucus. And when there is infection, when there is an active infection, the mucus gets thicker, which is more difficult, and which is even difficult on the intestines also. So access to medications like pulmozyme, Trikafta, everything, all the medications which are mucolytic, it's very important. And I'm trying my best also to reach out to pharma companies so that we can, do something about this. They get to know about the disease, and they help out the parents who are there in India for the reach of medications.
And we're going to wrap up in a minute because it is your
Yes.
evening. You've had a full day of work and delivering babies and everything else you do. And of course, it's morning here, but you've had a very long day. But do you feel desperate for other CF parents? Do you feel still that desperation you felt when you were losing your son?
Yes, of course. I'm still helping whoever comes to me, or whoever is, approaching me for medications and all. I am just trying to give whatever, I'm the buying for whichever cost I'm buying it. I'm just letting out in the same price to them, and whichever I can donate, I'm donating from my side. So I am desperate. I am trying to help them out. I'm trying to educate them what they have to do on a daily basis. So I'm trying my best, and yes, I'm desperate for every CF child to do anything for them, what they need.
And I feel your desperation, and I feel equally desperate for you from the United States. I feel like we are really in a hurry to raise awareness, educate, get all the ministers of health on board, get
Yes,
everybody working together to solve this problem.
solve this problem.
I feel your pain. My heart goes out to moms all over the country who don't have, the same healthcare and medications that we have in the US. Certainly, we're not perfect. We have many issues here, but
Okay.
compared to what you have access to
We
in
have,
India,
yeah,
it's
yes.
there's no comparison. So, you know, we're just hopeful that this raises awareness, this podcast
Yes.
and everything. And I appreciate you fitting time into your busy
No, no,
day.
no. Thank you very much for thinking about me for this.
So honored to talk to you. Is there anything, last thing you wanted to say to parents?
All safe kids are sweethearts. We'll try our best to get the medications for them. I'll try my best, and even as every parent is already trying, just keep trying. Don't lose hope, and don't lose hope on your child too. There is good life expectancy if we get the medications in India. So we'll keep trying. That's all. And all my love to all CF kids all over the world.
And that, it's so heartbreaking to hear from her. She's a really brave mom, and it tells us a lot about what moms and parents are dealing with in India, but, so very heartbreaking. And Dr. Varkki, you said that you lose about one patient every month to cystic fibrosis?
So sadly, in the last 6-7 months, that has been the situation. But during the COVID pandemic, none of my patients passed away. But in the last few months, I have lost many patients. And many, like I mentioned before, many undiagnosed CF cases die in early infancy. So that needs special, you need to be very, very watchful for the subtle signs of CF to recognize that. So we were able to identify many of these babies as CF after they died only because we saved some DNA sample, the genetic sample, stored some sample and tested it later. We were able to do that only because of CF Foundation help with the genetics to diagnose more patients. So, yes, so patients die at different stages.
And then I wanted to ask you, how hard is that for you to see on a monthly or daily basis? Just everything.
Yes, it is. It is very hard because these children. I mean, they start as a child and they grow. We watch them grow for 5 to 7 years before this happens, and it's heartbreaking because they share all their achievements at school and extracurricular activities with us, and so it's like losing part of your family when that happens. So it is a very heartbreaking thing, and in the initially. A few years back, it was getting to the level of being depressing, watch losing patients. Then I had a chance to attend the NACFC conference, and I realized how the attitude is different. How people are so positive. They are not worried about the imminent death, only because of the ability to keep these patients healthy and the hope of the new drugs coming in. So that really changed my perspective, that you have to be really, you have to work on what you can. There are some things which you can't change, but what you can, you have to do 100%. So that's what we encourage the families to do. Some things are not in our hands, but just focus on what you can do.
But so hard. And I mean, I would have to be in therapy. I would have to be truly talking to someone. I mean, do you do that? Do you feel like it's necessary?
At the time when I went for the first NACFC, I was there, and I had an opportunity to talk to some of the seniors doctors in Grace Paul's hospital, who shared the same thing. One of them said, "I changed my career because of this. I couldn't take this anymore. Losing patients." So I think that contact with these people who have experienced this in the past and how it has changed now. The professionals I saw now, I last year also I went there. They are more. I mean, I feel they have so much hope. So I want to take some of that with me. I don't want to be feeling depressed. I want to be hopeful, and I want to pass on that hope to my children, my patients.
And Dr. Grace Paul, you know this, you must feel for your friend, in India dealing with this 24/7.
Yeah, so I know even today she has come out after seeing 64 patients in clinic just
Wow.
today. So, so the volume is high, and CF is just one part of her job, and she is doing an excellent job. So I'm like truly blessed to have a great collaborator with Dr. Sneha, and so yeah, I think I do hear about these deaths that happen, and sometimes it's just another stepping stone. We have to do this. It brings out the urgency of why we need to do this. Like why we need to work more and advocate more and spread the awareness. So that's, I think, like, it's sad to lose a patient, but it's also a motivating factor for us.
It's a very good point. But I remember, just when I hear of somebody that I know whose child has died, before in my previous job, I was at work and I saw somebody posted the death of their child. I couldn't catch myself. I couldn't stop crying for like an hour. Like I really had to get it together to try and get back to work. So I just can't imagine when you're working in this every single day how hard it has to be, even though we're all living it to different degrees. It's just hard. But like you said, there is, positive, and we are educating people here about what's going on in India. Something else that I thought was interesting and I think is a fact that I know will appall some people, but you were talking, Dr. Varkki, sometimes after a parent in India has one child diagnosed with CF, you're doing, is it considered genetic counseling there, and they can have a medical termination if it were to, they were to have a second child in vitro?
Yes. So antenatal diagnosis, we have offered that option to many of the parents who currently have a living child or with CF, or who had lost a baby before. So at least in the last couple of years or 2.5 years, at least 8 to 10 families have taken that path, and they have normal babies. Fortunately, none had to abort. We just checked and the babies were not affected. So they go through genetic counseling about the chance of that happening, that being the next baby being affected is 25%, but there is a 75% of chance that the baby may not be affected. So they take that, and many families were able to have normal babies, and they are extremely happy about that. And there is a family where they had lost 3 babies, and the 4th one again was, that baby was affected, CF baby, but they may choose to have one more normal child. Mm-hmm. So that's something, in a way, positive, but medical termination is the only way out of that, which is sad. But, considering the situation where, they find that as a better option than losing a child later.
Absolutely. And I am not, who are we to judge? It is an individual decision. It is those parents, that mother's decision.
Yes.
It's definitely, I believe, not for us to judge what someone else can handle or do. Obviously, we need to make things better for the people of India, right? That's the answer. That's the solution, is to raise awareness. And that's what I wanted to talk to you about. What can we do for the future, for the people of India? How can all of us help? There's different things for everybody to do, from raising awareness to flying there to help you, or doing what Dr. Paul is doing. But what are both of your thoughts on what we can do for the future? And Dr. Varkki, if you'll start first.
Yeah, I must thank you for this opportunity to do this podcast. I hope many more people in other countries will hear about CF in India through this podcast. So this is definitely an excellent way. And, um, in the discussions which you have with people of different countries, whether you could talk about CF in India and the needs here, and help us raise awareness through different ways. People who have presence in the social media definitely are powerful in terms of that. So that will be definitely an excellent way to help us. Um, and we discussed about access to medications. I'm sure you will advocate for that, even for low and middle income countries where there is a need for access to these medicines, because India can, once the permissions are there, our pharmaceuticals can make these drugs and supply to the whole world. That ability is there, be it vaccines or medications. So it's just we need the permissions. So we really need help in that line eventually.
And Dr. Paul?
So, and I think that's where we can help is, the forums like what you can offer will get the attention of those who can actually help us, get in terms of resources, funding, publicity, everything. So that is important. And I truly want to thank you for this opportunity. With regarding to access to medications, I think our work needs to be to show numbers, to show the true burden of disease. So in India, it is really in a very bleak situation, but there are so many other nations which are even worse than what is going on in India. So, but the principles of care that we are creating, or the cost-effective models, these are things that can be utilized anywhere. And our goal is that we have all the time to do this and, make our center maybe as one of the key resources for many other places. So that's something we need to work on. And I believe that this is all possible. We just need to plan well and do it. Yeah.
And I think as we talk about solutions, education is key, right? You're saying raise awareness about the situation and statistics for the Ministry of Health. You're hoping that, you can do a pilot program, Dr. Varkki, with, that you can do with newborn screening. So you can get that going. I mean, you need to prove how many cases you have. That's kind of how other countries, low-income countries, have tried to go about it too. The Ministry of Health is huge. Raising awareness, getting pharma to work together, getting everybody to work together. It sounds like the more I talk to doctors in other countries, it is a group effort. It is getting all the parties to participate. And you need everyone to participate, correct? Are you working with other countries too, or do you just would you agree with what I just said about everybody needing to work together to kind of get this to change so that there's more of a level playing field for everyone? Dr. Varkki, you can go ahead. Yeah. Oh.
Yeah. So we are, sharing information, education with other countries, but I think Grace may be able to talk more about the CF Global Network. So especially with Bangladesh in training doctors and looking after many of their patients and, keeping them posted about how best to look after these patients. So Bangladesh is one country where I have close association with. I think through CF Global Network, Grace is able to reach far more than that.
So I think I have, really good friends from many other countries like South Africa, Turkey. There are physicians working in South America, Chile. And I'm learning from all these experiences that they have gone through. And I think we have all these pieces, and one of our network collaborative efforts is to put them all together in a very simple form, and so everybody can use it. So each person has done something excellent in their center. How do we put it all together and make it easy and accessible to everyone? So yeah, we do work with all these really good physicians. Some countries have a better infrastructure. They are in the low and middle income category, but they have a better infrastructure because some countries have small registries. They have good teams, multiple teams, and we are learning from each one of them. And I'm trying to do the same and help Sneha with that part. See what these other people have done, how they have succeeded in this small factor of CF care, and then make it available.
Well,
to
I think we're so lucky to have both of you in the CF community, and we are with India. We are with you. I think as I've become aware over the years and was shocked at my naivete, I guess, when I realized that, oh my gosh, everyone doesn't have the same care. I just assumed, like so many others, that everyone had the same care. And so it's been eye-opening. It's been sad. Myself and so many others are with you and trying to raise awareness and trying to get change. And it's not right. And we do need to find a solution to this so that everybody, again, as I said, is on the same playing field. So thanks for all you're doing. Thanks for sharing your story. Really important to get the information out. And I just thank you both so much.
The original music in this podcast is performed by Kevin Allen,
It's not complicated.
who happens to have cystic fibrosis.
We all got our worries and fears. I know it's got you frustrated, but loving you is so alright.
This has been the Living with Cystic Fibrosis podcast. For more information and to learn more about the Bonnell Foundation, visit our website at thebonnellfoundation.org. That's the BONNELL Foundation.org. This podcast was sponsored by Viatris and Genentech. It was produced by Jag and Detroit Podcasts. Follow our show in Apple Podcasts, Spotify, or wherever you're listening right now.